So I was going to say please stand, but you've already done so. Thank you very much. And for giving a warm welcome to the Honorable Kathleen Sebelius, the Secretary of Health and Human Services. Let's give her another round of applause.
Good afternoon, everybody. How are you? Good. I'm really delighted to have a chance to spend a little time with you, but I need to start with a warning. If you think that standing ovation was your exercise for today, get over it. It wasn't. But thank you for that warm welcome, and thank you, Danielle, for your leadership this year and inviting me to speak here today. I can't imagine a better time to come and spend a little time with the future doctors of America. And I know that this is a great group of young students who are looking eagerly toward a great profession. And you've all taken different paths to be here today. Some of you are the children of doctors. Others are the first in your family to go to medical school, some even college. Some of you have dreamed of wearing a white coat and a stethoscope since you were little. And others dedicated years to another career or another interest before you decided medicine was your true calling. You come here from big cities and little towns and will train in dozens of specialties and subspecialties. But you all have something very important in common. You are members of a generation used to instant gratification, and yet you've chosen a different path, a path that promises actually the exact opposite. You have the path of problem sets and weekend labs, 16-hour hospital shifts, and hours spent memorizing mnemonic devices. A path that requires you to study and train for as much as a decade and take out tens or even hundreds of thousands of dollars in debt before you are finally handed the reins to your own career. And I get the chance to talk to student doctors and ask them why they're willing to make those kinds of sacrifices. And it comes back to the same answer over and over again. You want to help people. You want to serve. You want to be healers. You know that being a doctor certainly helps to support a family, but it's not about that. There are other fields, clearly, with bigger, faster paychecks. What draws you, if you're like your peers around the country, to medicine is the unique opportunity to make a real difference day to day in people's lives. And as your careers progress, you'll have plenty of opportunities to do just that. You'll move out of the lab and the library and into clinics and wards. You'll be one who soothes the parents of a sick child, who follows a clinical hunch that saves the day. You'll help to deliver a newborn, tell family members that the surgery was a success, and hear over and over again, "Thanks, Doc. Thanks for being there." But I know I'm not telling you anything you haven't heard before when I say you'll also have different kinds of experiences. The feeling of helplessness when you discharge a patient who doesn't have enough social support, knowing you're likely to readmit them very soon. The frustration of having to make 7 phone calls just to try and piece together a patient's health history. The sinking feeling after a patient tells you they skip medications because they just can't afford what's been suggested. Now, we often hear about how those breakdowns and gaps in our health system affects patients, but what I know is they also impact doctors. They keep you from practicing the way you were taught and force you to spend hours fighting with insurance companies and filling out paperwork instead of being with your patients. And that's why, unfortunately, there are some older doctors who, when asked for career advice, sometimes say to students looking at the choice of a medical profession, go to law school. There's never been a worse time to be a doctor. But I'm here to tell you, if you only listen to one thing I'm going to say today, I want it to be this. that the people who give you that advice, choose another profession, this is a terrible time to be a doctor, are really looking at the past. The truth is, there's never been a better time to go into medicine than right now. There are serious and real flaws in our healthcare system, and they're going to affect you and your patients. But I would say, standing here today, I'm happy to tell you that for the first time ever in the history of this country, there's a real shot at fixing the problems, and there is a bright future on the horizon. Now, you all are entering medicine at a time of historic change. The combination of the wave of health innovation across the country and the most important health legislation in over 40 years has created a really unique opportunity. There's an opportunity for real progress in healthcare. Now, for the first time in decades, it's possible to imagine making big strides toward a 21st century healthcare system, one in which patients get the right care at the right time, Americans live longer, healthier lives, and doctors have more freedom to practice medicine the way they want to. And no one is in a better position to shape the future than those of you in this room. So, what does the future of the healthcare system look like? And while some of the details are going to be filled in by all of you, we already have some senses about the big picture. And I have to tell you, I just came from Ben Taub Medical Center here in Houston, and I had a little bit of a glimpse of that future because they are one of the most innovative big health systems that I've seen anywhere in the country. But let's talk a little bit about that new system. First, I think, is a critical shift in focus, a new national focus on prevention, both inside and outside the doctor's office. There's clearly a growing body of evidence that people's behavior outside the health system, what we eat, how much we exercise, whether we smoke, the air we breathe, the water we drink, affects our health just as much, if not more, than the treatments and medicine we get when we interact with the health system. And so for doctors, that means experiences like designing the perfect regimen for your patient with diabetes, only to see them go home to a neighborhood where they don't have any healthy food choices, and you know that their diet is going to immediately interfere with your great protocol. We know that over the last 3 years, we've begun to launch the first serious national effort in this country to deal with people's healthy choices, making the healthy choice the easier choice, funding innovative local programs for reducing chronic disease, and trying to figure out what models work and make the models for the rest of the country. We have new laws helping children get healthier meals when they eat at schools. What a novel idea. If we're going to feed kids at school, why not make sure that ketchup is not a vegetable and that they actually have access to healthy meals throughout their day? We have historic legislation for the first time that really goes after the tobacco companies, targeting companies who continue to off-market to kids. And let me give you a terrifying statistic that we just rolled out yesterday as part of the Surgeon General's report on youth and smoking. We still have 3,800 young Americans under 18 each and every day who try their first cigarette. 3,800, and 443,000 people a year die from smoke-related deaths. So we have a huge issue. We're also making it easier to promote good health in your practice. A key benefit of the healthcare law is that recommended preventive services like cancer screenings and vaccinations are now available for Medicare beneficiaries and for private health purchasers at no additional cost. So people no longer have to worry about skipping a recommended screening or not following up on advice because they don't have a copay and they can't pay the coinsurance. The healthcare system of the future not only will be about prevention, but a greater focus on primary care. Now, I'm just curious, how many of you in this room are thinking about going into any kind of primary care? Is that, oh, that's good news. How many who didn't raise your hand would have that as a stronger consideration if there was a closer pay equality between primary care docs and what specialists make, an easier way to pay off your loans. Is anybody influenced by that gap? A few more people. Yeah, a number of people. And I think that's one of the system changes that we have to make. Primary care is too important to be treated as if it was of secondary importance. And that's why the Affordable Care Act has given us a bunch of tools, increasing reimbursement rates for primary care, adding thousands of slots to the National Health Service Corps, which is a favorite program of mine, which is sort of our Peace Corps for health workers in this country that makes a deal if you agree to serve in an underserved area for a couple of years, we help repay loans or provide scholarships in the first place. And we've tripled the numbers and intend to increase that program. And I think it's a real win-win situation. And part of the reason we're going to need more primary care docs is that you're the key to care coordination, something we'll need a lot more of in the healthcare system of the future. Thanks to the medical breakthroughs of the last 50 years, millions of Americans today are living with chronic conditions that would have killed them 50 years ago. Now, the good news is they're living a lot longer. The bad news is we have more and more patients suffering from multiple complex chronic conditions. So take a patient with congestive heart failure. Likely she also has chronic asthma, may have uncontrolled diabetes, and is often a smoker. Good care for this patient has to be a team effort with primary care doctors and specialists, but also nurses and community health workers and substance abuse counselors all working together. As the doctor and author Atul Gawande likes to say, for the future of healthcare, we need more pit crews and fewer cowboys. That's really the healthcare of the future. And now the healthcare law is changing how we pay for care to also support that kind of care coordination. For example, we are looking at bundling payments, so hospital discharges have a follow-up care plan, and make sure that patients don't get unnecessarily readmitted because they haven't seen any kind of provider in the meantime. Making sure that that care is followed up on. We're supporting accountable care organizations led by healthcare providers that get paid for actually keeping people healthy in the first place, not just by how many tests and procedures are run. But to provide that new coordinated care, you just can't do it overnight. The good news for you is you're entering medicine at a time when you're going to have some new tools, when the file cabinets will be a thing of the past. Thanks to a law signed by President Obama in 2009, there are powerful new financial incentives and supports to help practicing doctors and hospitals switch to electronic health records. And after decades of talking about this, we're finally seeing some real results. Let me just give you a snapshot. In the last 3 years alone, since that bill has been signed, the share of primary care doctors switching to digital records has doubled to almost now 40% of docs. That's good news. And it's on pace to exceed 50% by the end of the year. Hospitals are also taking up electronic health records. And again, I saw at Ben Taub, the hospital that was named the most wired hospital in the country in 2011. They've had a system in place for years, and they deal with a very complicated, very challenging population where 50% of their patients are entirely uninsured and another 25% are seriously underinsured, multilingual patients, and they have a very robust electronic record system. I keep saying to people, can you imagine any other sector of this economy? Now, healthcare is about 17% of our GDP, still relying on paper files. Imagine if many of you are too young, you probably don't even remember these days, but there used to be a day when you had to actually write a check on a piece of paper and wait till the bank opened and stand in line and present them your check and someone would give you cash. You had to pay every bill by writing a check and putting it in an envelope and putting a stamp on that envelope and sending it in. Those days are long gone. You can't even imagine running a corner grocery store if you had to mail in an inventory to get your supplies and have those supplies. But the entire healthcare industry is still running basically on paper information being exchanged back and forth. So that's a huge underpinning for better care coordination, fewer errors, lower administrative overhead. And you all are going to be able to take advantage of that. A big difference for both you and your patients are going to be the huge changes happening in the health insurance system. Now, in the past, far too many healthcare decisions were dictated not by what a patient and doctor thought was best, but by what an insurance company would cover or not cover, or what a patient's private finances would allow. Too many people continue to show up in emergency rooms with health crises that could be prevented. Cancer patients had to abandon chemotherapy regimens because they hit a lifetime cap on their insurance policies. And parents with sick children, and I see these folks each and every day, were terrified about losing a job, which would involve losing insurance coverage, or imagining that their child would indeed survive a childhood illness only to never be insured again for the rest of his or her life. So for the first time, we have a healthcare law that's getting rid of the worst insurance abuses that we've known in this country, and this is long overdue. We have a new Patient's Bill of Rights that makes it already illegal to impose lifetime limits on an insurance plan. That doesn't affect many people, but I can tell you the people it affects, it's absolutely life or death. It makes it illegal to cancel somebody's coverage when they get sick or because of an error in paperwork, the so-called rescission practice that many insurers use. And in 2014, when you begin your residencies, for the first time in our history, every American will have access to affordable health coverage. Let me repeat that. Every American will finally have access to affordable health coverage. The result will be a health system where you'll be able to begin conversations with your patients by saying, what can I do to help? Not, what kind of coverage do you have? And can we indeed find a treatment plan that fits in the small print in your policy? Doctors really are leading this change. The 21st century health system is taking place already in cities and towns across this country. As I said, I've already seen a glimpse of that future here at Ben Taub General Hospital in Houston. And one of the most impressive things is that they really see their job as an elimination or limiting the number of inpatient days anybody spends. They have a huge focus on outpatient care, preventive care, 13 major clinics throughout Houston, another 9 in-school clinics, robust practices, and all of those systems are linked with this electronic system. So their job is to keep people out of the hospital unless entirely necessary, and to get them out of the hospital and keep them healthy if they need to be admitted. And that's a very different focus on healthcare. They've talked about how putting in their electronic health system has begun to reduce preventable events. And putting a new focus on prevention, they're doing everything from sponsoring farmers markets to using mobile vans to reach patients in their communities. Very innovative strategy. And what's happening at Ben Taub is happening in pockets around the country. And all the innovative hospitals and health centers I've visited have one thing in common. A lot of them have electronic health records, but all of them don't yet. They're coming on board. Some do outreach to their patients to manage chronic conditions, but others still don't. It's common for the best systems to put an emphasis on primary care, but that's not universal. But they all have one thing in common, the one indispensable ingredient for improvement, and that's physician leadership. Now, I can't imagine anyone who's better prepared to provide that leadership than those of you here in this room. For one thing, you've grown up with the technologies that play a key role in the health system of the future. I also hear from older doctors that you understand intuitively that healthcare has to be a team sport. It is not an individual practice. It really involves a lot of different skill sets. And simply being here today, you've shown you've already learned another important lesson, that your work as a clinician is just one of the ways you help your patients. And perhaps a better way, or another way you can help, is by working to build a better health system for all Americans. And you're doing that right now, and I want to thank you for that. So this afternoon, I want to urge you not to give in to cynicism or complacency when you have some of those frustrating experiences I mentioned earlier. It won't be easy. When you're working 14 or 16-hour shifts in the hospital, there'll be a temptation just to put your head down and finish your assignments. When you see the same error happening again and again, you might find yourself wanting to say, well, that's not my job. Somebody else is going to fix that. When you try out a new model of care, it might not work all the time, and it will be too easy just to go back to the old way of doing things. But we, those of us across America who rely on a great health system, need you to persevere. We need you to maintain your focus on a new and brighter future. We need you to be the leaders of that future healthcare system. And you should want to be the leaders too. After all, we're talking about a health system that many of you will spend the next 3 or 4 decades of your life working in. If we seize the opportunity in front of us, I believe you can be the generation of doctors that helps us usher in a new day for healthcare in America. One in which communities are healthier and more prosperous. Patients get better care and have greater satisfaction. And 40 years from now, you can tell the future medical students when you talk to them that this is indeed the best job in the world, that you made the best choice to be there. So thank you very much for what you do each and every day. I want you to know that I try to travel with as many students and future docs as I can, and with me today is Elizabeth Cote. Where's Elizabeth? Who's here. Elizabeth is over on the side. She was a part of this organization as a student. She took a year off from her anesthesiology residency to come be a White House fellow and work with me at the Department of Health and Human Services. So she is my up-close and personal future doc, who I like to keep a hand on. But thanks for being part of this amazing association, and I understand you may have a few questions for me. Right?
Yes. Is this working? Andy, you got it? Okay. All right. So we did have a few questions that were actually submitted by our members, and so as you all know, we went out.
It's a little terrifying. I'm wearing the same necklace and pin that's in that. Luckily, I don't have the same jacket on, but I have to change up my outfit a little more often.
So these questions were actually submitted by you, our members, and so we're going to go ahead and ask the Secretary 3 of those here today. The first of which was there a defining moment in your life that led you to your current role as Secretary of Health and Human Services?
The president asked me. That probably was the biggest piece of that puzzle. I've worked in, I am not a doctor. I have an undergraduate degree in political science and history. I have a master's degree in public administration. I went to the legislature in Kansas a long time ago, and in the legislature began to work on healthcare issues. I was just interested and thought it was an important area. I then was an elected insurance commissioner in my home state for 8 years, and then as governor, not only worked on health policy, but also I was one of the largest health purchasers because we ran the state employees program and the Medicaid program and health services for jails and looked at issues around counties. So I've had various lenses on the healthcare system, and always, I think, in that public life have been really engaged and involved. Being in this job is amazing because I get to work with some of the smartest people I've ever known in my life, the most dedicated, mission-driven folks, and work on everything from the amazing science and research that's going on at the National Institutes of Health to the whole public health infrastructure with the Centers for Disease Control and Prevention, the new drugs and new devices coming out of the Food and Drug Administration, as well as the whole primary care workforce. We run the Ryan White program, but those are all just the basic operations of HHS. And then to be there at a time where after 70 years of back and forth debate and dialogue, Congress was able to pass and the president signed the healthcare law that's actually been proposed by Republicans and Democrats over the years is just such an historic opportunity. It's been just a great honor to be there at this time and to be implementing this amazing law that was signed into law about 2 years ago this March.
Thank you. The next question is, what do you perceive to be the effects of the politicalization of healthcare on the practice of medicine?
Well, hopefully there won't be a huge impact of some of the poisonous partisan atmosphere on medical practice, particularly if we can achieve a successful resolution at the Supreme Court. I'm confident that the framework that's in place will really have a very positive impact. I think the debate that's underway in Congress is not particularly helpful, and it's not very informed about what is the best way to either practice medicine or deliver care to people. It's really much more about scoring political points, and hopefully that will come to an end sometime soon. I take some comfort from the fact that every controversial change in this country has had a somewhat tumultuous period getting in place. Certainly the Civil Rights Act did and the Voting Rights Act. But when Social Security was passed, and that may be the closest example, it was 5 years between the time that taxes were collected and the first person got the benefit. And during that period of time, there were numerous congressional challenges, a couple which went all the way to the president to repeal Social Security and were vetoed. There were several constitutional challenges working their way through the court, but once the benefits began to flow, the debate was over. What we're seeing now, just 2 years into the implementation, before we get to the affordable exchange portion of the law, which I think will have an even greater impact, is people already beginning to understand that this law has some real benefits. So I can guarantee you parents with kids under 26 now understand that their young sons and daughters can stay on a family plan. And we've got 2.5 million young Americans who have insurance today who didn't. Families who have a sick child know that it's now illegal to lock that child out of the health insurance market because of a pre-existing condition, and they know that's there. And certainly seniors on Medicare who were told terrible things, that Medicare would go away, that their benefits would be gone, that the program would be destroyed, are now seeing not only that didn't happen, but more benefits, stronger programs. So I'm hoping as people begin to connect with not the theory of what the law could do, but with the real benefits of the law, that some of the partisanship will actually die down. And the debate this year is going to be different, because the debate really about repealing the law is about taking things now away from people and taking things away and saying we're going to turn it back to the insurance companies, and they can pick and choose who gets coverage and who doesn't. And they can, oh, by the way, those of you in the room who share my gender, being a woman will no longer be a pre-existing condition in the insurance market, and that's very, very good news.
And the final question was, what do you see as the role of physicians in training in the patient safety movement?
Well, that's a great question. You know, I think that it's important that all of us have some really candid conversations with the public about what are absolutely great things about the American system of healthcare. We have the best research in the country. We have access to some of the best care systems. We have enormous potential. And yet, you know, we are still spending twice as much as almost any nation on earth, and our health results are pretty mediocre. And part of those health results is what happens to people when they come into a hospital setting. We still have 100,000 Americans every year who die, not because of what brought them to the hospital, but what happens to them in the hospital, the so-called iatrogenic injuries. We have hundreds of thousands who spend longer times, are far sicker, are in much worse health, and spend a lot of extra money because of that system. So doing some things which we've started on, like lowering the number of hospital-acquired infections, having protocols in place that look out for preventable readmissions, which are part of a new focus on safety, I think are so very important. So those of you who are in school now and are going to be the emerging new leaders, the systems that really take on safety as a number one issue and look at doing no harm as really the primary goal, not 20% harm or 30% harm, but like the number has to be zero. The goal has to be zero. We can't say, well, it's okay, we'll just harm one out of every 5 people, you know, and that's a really good system. Are dedicated to it. Electronic records are a big part of that. To look at the care protocol each and every day, figure out what people are doing, following the same systems, having checklists, and a team approach to care so that everybody is empowered and everybody's job is to be part of that safety system has been a new trend. But I think you all have enormous opportunity. I mean, if people, you know, we are having a constant debate about how you actually reduce the overall costs of healthcare, which have been on a dramatic increase in this country, a dramatic rise. And I'm not talking about the cost of the public programs, which is too often the debate, you know, lowering the cost of Medicare or lowering the cost of Medicaid. We should be looking at the health system. How do we actually bring down those costs? And one of the best ways to do it is improve care and improve the quality of that care, and not pay for things that don't work, and certainly not pay and have a system in place where we limit injuries as much as possible, focus on safety, you know, have a better system each and every time for each and every patient. And you all can be the forefront of that, and unless you are, it won't happen. It absolutely won't happen. It'll be talked about a little bit, but it will never happen. So you are the key to a much safer, more efficient, higher quality health system in the future.
Thank you very much. Thank you very much. Let's have a round of applause.
Okay.